Hello and welcome. Thank you for joining us this morning for our webinar on healthcare, social care and public safety with 5G. We have a great lineup of panelists this morning. I'm proud to be co-chairing this webinar with Dr. Andreas Müller from Bosch, who is chair of the 5G Alliance for Connected Industry and Automation. This is one of the industry associations behind this webinar series. The others are 5G Automotive Association and 5G Infrastructure Association, and also the Public Safety Communication Europe. And I'll be passing the floor in a minute to Dr. David Lund, who is president of PSCE, who'll be making a brief announcement on a major milestone for Europe and public safety. So I think I will then, let me just pass the floor then over to you, David. So there you can see the moderators and David, Dr. David Lund. Thank you, David.
Thanks, Stephanie. I just want to make a brief introduction note. Public safety is our topic from Public Safety Communication Europe Forum. So I'd just like to say a personal thanks to the three speakers, to Andreas for chairing, with Stephanie as well for all that arrangement, Stephanie, that's great. So we're using these events just generally to first of all share information and debate between the vertical sectors. In public safety, we drive vehicles, there's an automotive factor there. And in industrial control, safety is implicit. So public safety is our core topic, and we see value in this vertical sector collaboration. So just to make a quick announcement, really, the public safety, we made some really big progress in the last week. So our program, we've been coordinating, preparing more than 5 years now, Broadway project. We signed 3 contracts with supply teams to deliver pan-European mobile broadband solutions for public safety last week. This is all built upon the 3GPP mission critical services layer. So first of all, we'll sincerely thank our standards community for that. There's been a lot of work there behind it. However, we've now got the challenge to build that. So these contract signatures have been quite a milestone for us. So as we move forward and think forward about how we're going to use the 5G technology and how we're going to make best use of that standardization activity, we thought about the topics of today. And of course, we bring together more considerations really in public safety. So not the ones that we think primarily for us, because our work is about helping the responders to communicate more effectively, but actually health and social care. This year it's become a big topic. So we're really interested to hear today the speakers' views on that. And health and social care, it's an extremely important safeguard in our community, even minimizing the need for our responders to have to do their job, So let's try and save lives before they have to be in a disastrous situation. So I hope you enjoyed today. Thank you, Stephanie. Thank you, Andreas. Thank you, speakers. And I'll hand you back, Stephanie. Thanks.
Thanks very much, David. And very good news indeed. In fact, one of the drivers behind the webinar series is to help bring industry verticals into the standards work, primarily in 3GPP, and we work very closely with the chairs of that organisation. And one of the supporters of today's webinar is also the technology platform NetWorld 2020, and we'll be sort of using this webinar as a launch pad also for future events on these topics. So hopefully we'll get some great insights this today. So I'll pass the floor now to John, who will be launching our first poll. So over to you, John.
Yes, hello. So our first poll it has been launched now, and it is: what do we see as the main barriers for 5G for healthcare, social care, and public safety? And we have a number of possibilities here that we'd like you to vote on. Privacy and security issues, lack of funding, lack of government support, lack of harmonized regulations, strict regulations in the healthcare sector, or technical barriers like response times, lack of broadcasting facilities, device autonomy. I see the votes coming in, that's great. So as you can see, the winner, so to speak, is privacy and security issues. And close behind is the problem of strict regulations in the healthcare sector. And right behind that is a lack of harmonized regulations.
Yeah, very interesting indeed, yeah. I'm not sure if Dr. Christoph Thümmler is on the line yet, so I don't know if you can confirm if he is or not. If not, we'll move on to Graham Worsley from the UK 5G project called Many, and this will look at diverse use cases across all of the webinar topics. So I will stop sharing my screen and we'll move on to the first presentation. The floor is yours, Graham. Thanks very much.
Okay, everybody's seen my screen, I hope.
We can, I can see it, yes, we can.
Good, right, okay, I'll fire away then. So I'm working for a company called Safenetics Limited, which is a small company based in Lancaster, associated with David Lund. But I'm also the director of a trade association in the UK called the Digital Health and Care Alliance. So a lot of what I'm going to be talking about is generic issues around health and social care in the UK. First of all, with the project itself though, it's a collaboration between local government, some comms companies, some SMEs, and 2 universities. And it's in an area of Northern England called North Yorkshire. So it builds on previous 5G projects which have been supported by the UK government DCMS, who have had a testbed and trials program running for a couple of years now. Within this actual call, there are 7 rural projects in total, of which our project in North Yorkshire is just one. So it's designed to identify challenges in using 5G across different sectors and different regions, focus on building scalable models. And key technical point is that projects can apply for spectrum where the existing licensees have no rollout plans for 5G. So North Yorkshire itself is largely rural. It's got poor mobile data and voice connectivity. So there's even areas where there's no 2G, and so very limited 4G. So that you're looking at not only putting 5G in, but actually providing mobile access where there is very limited mobile access at the moment. So the objectives of the project include improving well-being and mental health, specifically discussion around loneliness in rural areas, boosting tourism, providing mission-critical support for the emergency services network, enhancing the area through environmental monitoring because it's an area that's been prone to flooding, providing a better mobile signal, and offering quicker home broadband. So a lot of it is bottom up. So the aim is to demonstrate how mobile access can assist in the recovery of the social and economic fabric of rural communities, unlocking their potential. So that's the background to the area and the project. This is a map of the 7 areas of this part of North Yorkshire that actually been targeted. So the nearest town on that map is actually a town called Harrogate, and the nearest bigger place in this part of Yorkshire is actually the city of York, which is down to the southeast on that map. But we're looking at those 7 rural areas and looking if we can provide coverage in those 7 areas. So this is a quick run through the project partners. I won't read them all out, but Quickline Communications is the infrastructure provider. It's a 2-year project which starts from the 1st of April, which started from the 1st of April this year. So it's actually a very new project. And obviously we've been very limited by what we can do by COVID-19 and the lockdown that there has been in the UK. So we're looking at 4 use cases: tourism, health and social care, targeting particularly loneliness, environmental monitoring, where flooding is an issue, and for the emergency services, initially we are looking at mountain rescue, because you're in some high hilly areas as a proxy for the emergency services. So quick technical summary. So as I said before, we're in rural areas with very limited coverage of even 2G. so that we need to manage expectations and also plan for sustainability. There is also no equipment provider in the consortium, so you're looking for open source. And there are, of course, very few 5G suppliers with equipment actually ready for trial use. So we've got looking at a three-phase approach: 4G to 5G non-standalone, SDR and open source, finally ending up with 5G standalone supported by fiber and wireless backhaul. One of the probably things we're going to end up doing is actual showcase events, which will include use of the University of York Helicite. So far, we've undertaken some coverage surveys, and we'll use several of the bands available. David Lund has also completed a security strategy for the project as a whole. I'd like to talk a bit now about specific UK challenges in health and social care. It's worth bearing in mind that although the UK NHS is, I think, the 6th largest employer in the world, it's not one system, but it's complex, multi-organisational structure. It employs in total 1.5 million staff and had a budget in 2019-20 of £135 billion, which, is about 150 billion euros. The issues, though, and I think, in fact, contrary to the poll that's just gone ahead, that the major barrier for uptake of health and social care in the digital area is actually the business model, and it's the business and organisational model, which wasn't actually included in the panel, I notice. But in the UK, health and social care are separate, and they're not necessarily well integrated. There is, for instance, with no common electronic health record, and there's a different series of electronic health records in use in different parts of the NHS. Like football, the NHS is not UK-wide. We've got separate teams for England, Scotland, Wales, and Northern Ireland. In England only, there's a number of central organisations. So there's NHS England, NHS Digital, NHSX, which is also looking at the digital issues. There's an organisation called Public Health England, and there is an organisation called the Care Quality Commission, which overlooks social care. All funding, though, is allocated by, in England, comes from the main department, which is Department of Health and Social Care. There are also external organisations to getting technology approved as well, called NICE, and there are app accreditation bodies, including ORCA. Important to note as well the split between primary and secondary care, and that GPs are not actually employees of the NHS, they're private partnerships. Then the NHS in England, there's 135 care commissioning groups, there's 7,500 GP practices, 220 hospital trusts, and 10 separate ambulance trusts. Social care is run by 152 local authorities. Pre-COVID, there were 650,000 home care staff with 110,000 vacancies. Now I see that's 120,000, 19,000 separate businesses. There are no laptops for social care staff usually, and there's no data sharing with the NHS. They've also found that a lot of social care staff are not actually necessarily English literate. So let's look then at the impact of COVID-19. So there's been enormous changes, particularly to GP services as well as hospital care, most of which have moved to online triage. So that's online triage as well. 90% of patient management is now online, whereas before it was 90% face-to-face. But it's not video consultation, which is still very low, somewhere between 0 and 2%. It's either triage questionnaires that are answered before people actually get involved with the GP practices themselves, and then consultations are mostly over the telephone. What we found as well is that there's enormous unmet need now from outpatient clinic and a backlog of other disease interventions. But there's been enormous interest in the UK in addressing the crisis. Our funding body, Innovate UK, had over 8,000 ASME applications for a 50k grant for non-direct measures such as patient rehabilitation, and they doubled the money available and they're now funding 800 different projects. So going back to the health and care in the Many project, this is led by North York Council. And so they're having a bottom-up community useful consultation approach, which they've only really just got going. Two potential obvious applications are patient access to GP video consultations in the community. Fortunately, all GPs in North Yorkshire area have signed up to one company, which is a company called Accuris, which provides video and links to electronic health records. They're also going to investigate voice assistants, but probably not Alexa, in the home for support for loneliness. Let's have a quick look now at the public safety and security use case. This is led by SafeNetics. A little bit of background. The UK, of course, has a 4G project underway for the emergency services networks, and so we're not proposing to impinge on that and trying to directly demonstrate capability, 5G capability of the police, fire and ambulance. So you're using Mountain Rescue, we hope, as a proxy demonstrator, because they have the same kind of services that we need to actually look at. So we've been in discussion with the local Mountain Rescue team. Part of their requirements, though, are for more robust and resilient comms infrastructure, and they've got a fairly efficient existing DMR system. We need to look at interoperability issues from the DMR system to 5G, and also look at things like helicopter rescue. Potential kind of applications we'd like to explore include medical telemetry, use of video, particularly infrared for nighttime search, use of drones in the University of York Helikite, and remote vehicle mounted base stations. I'd like to finish on some final thoughts. I think that my background, having spent the last 15 so years looking at digital health applications, there's lots of potential digital health applications, but do they really need 5G? You've got to bear in mind that there's staff shortages within the UK health and social care, and I'm sure that applies globally as well. It's resource intensive, but it's a very complex structure. You need to change the business model, the clinical base. People will always say, where's the evidence base? But you can't do randomized controlled trials around technology. It doesn't work. We tried that in something called the whole system demonstrator. But COVID-19, again, has shown that you can change things and you just crack on with it without looking at an existing evidence base. The major blockage on introduction of digital health applications in Europe is going to be the devised medical device regulations. That's already having problems, and it was delayed for a year until May next year, but that's still going to hold back digital health applications. We need to think about applications for the mission critical layer, but also improve the business model for the police, fire and ambulance. I've looked at other applications in the past. I think there's potential for robotics in the home. I was involved in a project called Chiron. There is also potential for home-based physiotherapy, exercise monitoring. A lot of work has gone into falls. Could you use virtual reality? Again, a couple of UK projects there called Sphere and Datagate. Also interesting things in the past, including home-based renal support and sleep monitoring. Final thought on surgery, because that's been surgery, but I have to say I'm not convinced that people will really use 5G for surgery in a meaningful way. I think it's a good example of things you can do, but really, why would you use 5G if you can use fixed broadband? And surgery is a very, very complex thing to be getting into. So I think that it's a great demonstrator, but don't think it's actually going to be a business model that's going to be used very widely. So that's it. Thank you very much. A little bit of information about where you can find more details about the Many 5G project, and there's my email address for any subsequent questions. Okay, thank you.
Yeah, we thank you, Graham, for this very nice presentation. Thank you very much for that. And I think you showed nicely that it's not just technical challenge that we have to deal with, but also, for example, organizational challenges. You pointed out the complex structure of the NHS, for instance. And of course, these are also things that need to be considered and to be thought about how to deal with these constraints and challenges here. Maybe just a quick question after the presentation. So you have outlined some use cases and applications, of course, that are relevant. Maybe a little bit a theoretical question, but do you think that we really need 5G for all of them? Or is it in many cases primarily about providing some basic connectivity? You mentioned the video consultations, for example, and so on. So are there really use cases where you think this does not work without 5G, or how do you see 5G compared to other connectivity solutions that are already out there?
I've not seen them yet, but I think you have to look for them, because you won't know until you actually go looking for them.
Yeah, that's already a fair point, right? So you have to understand the technology, and then it's an iterative process basically to see what you can do with it, and also to align this then with the use cases and applications.
Yeah,
I guess this holds for many different verticals, of course.
Yeah, I think that's right. Yeah.
Yeah, but thanks. Thank you very much indeed, Graham. So we still have some time for discussions and for the questions from the audience at the end of this web seminar. And I just would like to invite everybody also to post your questions in the Q&A panel while we are enjoying the presentations, and then we can pick them at the end and bring them up for any of the speakers, of course. But now it's my pleasure to announce the next speaker, which is Christoph Thümmler. So I think he should be now on the phone. Christoph is Director of the Department of Geriatric Medicine and Early Rehabilitation at Helios Park Klinikum in Leipzig in Germany. Before that, he was a professor at Edinburgh Napier University for many years, and as part of this, really an early pioneer in the areas of e-health, m-health, and also 5G for healthcare. So we've been knowing each other actually for quite some time. It's always a pleasure. And I cannot imagine a better expert, to be honest, for 5G in the healthcare domain than Christoph. He's also a medical doctor. That means he knows what he's talking about also from the perspective of the healthcare domain. So thanks for joining, Christoph, and the floor is yours.
Well, thank you very much, Andreas. So can you hear me okay? Actually, the invitation to join your webinar comes just in time, because today I want to announce something which actually was a matter of discussion for many years. We know that there are a lot of associations and which are very helpful in pushing the 5G forward. And Andreas, you're leading on one of these organizations yourself. There are other organizations like 5G AA and so forth. And there's always been the issue about a 5G Health Association, and why do we not have one? I mean, a 5G Health Association is a tricky matter, you know, because health is so diverse across Europe and across the world. It is basically positioned in so many different ways. If you look in state-run systems, for example, like the NHS, we're just hearing about that, and other systems that are partly private and partly state-run, like, for example, in Germany. So there is a lot of diversity, and it is very difficult to get people together and start up this association. So as far as I recall, we were thinking about that ever since 2014, 2015, and it is always a little bit of an issue. Now, let me start my talk with a small disclaimer, because these things are very important these days, or seem to be very important these days. So first of all, I'm working for a big organization which is called Helios. We are a big company. We are running around 200 hospitals in Germany and in Spain. We have a lot of outpatient clinics, and we are part of a bigger company called Fresenius. So today, it is simply only reasonable that I tell you that my following talk represents only my own personal views and my own views only, and does not display the views of my employer or any other third party. I do not have any financial interests in this, and there is no commercial funding or sponsoring of these talks. The only thing which I have to flag up is that my organization or my department, we are getting national funding under the eHealth Sachs program of the government of Saxony. We are in the moment bringing together a campus network which is 5G based and will be basically a private campus network, which then can be used for medical communication and trials, which are very important. If you could go to the next slide, Steph, that would be great. Yeah, so let's just discuss what the current situation about 5G in healthcare is. So we have, back in 2014, 2015, 16, we started to see the first white papers are coming up. So I just put down 3 papers which I think are quite important in this context. So you can see there is a white paper on e-health verticals, which you find on the webpage of the 5G public-private partnership. This was a paper which we put together back, I think, in 2015. And we were just basically starting up with the first thoughts on requirements of 5G in the health domain. You can look that up. The paper is still there, but it urgently needs an update, which I think we will be seeing soon. And I will talk about this a little bit later. Another quite important white paper was the Wireless World Research Forum white paper, a new generation of e-health systems powered by 5G. This was a kind of cooperation with many players that are typically in this EU environment, and we brought that together and published that. It must have been around 2016 as well. And then, of course, the NGMN published a white paper which was more general in nature, but they were also looking at 5G in health aspects in this white paper. And it's quite interesting to have a read through these white papers and see where the starting points of this all were. If you could go to the next slide, Steph, please. Thanks. The problem is we are seeing a lot of 5G challenges in healthcare. So healthcare always had a couple of problems to adopt the technology. If you look at AA, for example, 5G in automotive was never really a big question. So there's many applications, either in manufacturing or there's applications that are basically trialed, like, for example, the S7 project in Germany, where you try to figure out how you can make use of 5G and connect the cars directly or with each other. So I think these things, they were always more or less understood that this is relevant. Smart factory is a little bit the same. So 5G as a means to connect machines and robots to control the processes in the factory. Everybody understood that. But when it came to healthcare, there were always a lot of questions and still are. So basically one of the biggest problems that we're facing in the moment is a general information deficit in healthcare. So people or organizations, I should say, they just start to understand the potential benefits of 5G. And of course, a big problem is that when you address people and you talk about 5G, especially in a health context, they are unsure what you actually mean. So 5G, what is it? Is it something much bigger or nicer than 3G or 4G? Or do you mean radio access technology? Or do you mean core technology? What are you talking about? So I think there is a lot of work to do, and I think organizations like 5G Global and events like this webinar, they're extremely important to really propel 5G in the health domain. Then what I found in many discussions is that people do have health and safety concerns. So people thinking about health risks, because 5G, the thinking of radiation, non-ionizing radiation, microwaves, and so on, they're really concerned. So there is also an information deficit. And the same accounts with privacy concerns. So we saw in the past that the telcos and the telecom operators, they were all very keen to provide 5G services to the hospitals. But of course, this is a big challenge, and it's not easily possible, because hospitals take responsibility and have the responsibility, the legal responsibility for their patient data. and they have grave concerns to just hand that over to a telecom organization who would not accept any responsibilities for the data. And this is a big challenge, and it still needs to be discussed if these things are strategies that could be used in the future. So these are already big problems, but it goes even further, you know. I mean, there were conspiracy theories around, especially now for that COVID-19 pandemic situation on the internet, where there were some kind of weird connections made between 5G and COVID, and how this goes together, and one dependent to the other, and people, they got scared and concerned, and these are mostly the patients that are coming to us and voicing these concerns. So a big problem. On the other hand, you know, the geopolitical discussions that we have, for example, you know, the stake of Huawei in 5G and all of these kind of things, these discussions are not helpful either. And then, of course, this is goes together with the privacy concerns, you know, the data ownership. I mean, according to the General Data Protection Regulation by the EC, in the discussions we had in the past, it seems to be clear that the data belong to the patient, but it's not that easy, because if you look at a medical record, it's not only patient data that is in there. There's also materials that belong to doctors, interpretations of X-rays, of CT scans, or diagnosis, and so on. So this is not all the patient. It is also proprietary. You have to allocate that to the doctor. And also you have the issue that healthcare provider, they see part of that information at theirs. And also pharmaceutical companies, for example, if you think about smart pharmaceuticals, using smart inhalers, smart diabetes pen, and so on, they're trying to also use this information and claim ownership in this information. So you see there's a whole cloud of issues that actually in the moment where we struggle to push 5G into the health domain, which is mostly not even technical issues. Okay, Steph, if you could go to the next slide, please. Yeah, I think it is very important also to understand what are the drivers? What are the drivers for 5G? What are the main drivers for 5G? And Guy was saying already beforehand, what is it actually that we gain with 5G? What is actually the difference between 5G and 3G and 4G? And this is an issue that comes up all the time. You know, why do you need 5G for that? Why can't you do 3G, 4G, whatever? I think there's two main trends that have to be understood, which have nothing to do with technology, but they are soft factors, social driver. So on the one hand, you can observe over the last 30, 40, 50 years a trend from a centralistic structure, a centralized approach, also hospital-based and provider-centric care, towards a distributed patient-centric care pattern. That means in the old days, you had one GP, and the GP would see you, and if it really, really was necessary at one point when you had an injury or whatever, you would go to the hospital, they would fix you, and you would come out, and these were the 2 points of care delivery, nothing else. This has changed completely. So we are looking today at a development where the patient care will be distributed. So you will receive patient care in many other places, but the hospital. The hospital will be a kind of last resort. That means if you really have a disease, an illness, or an injury that is so difficult and complex or so severe that it cannot be treated under no circumstances elsewhere, you will have to go to the hospital. But most conditions will be treated outside the hospitals, in care homes, in clinics, in any other setting, but hospital. Many processes can already be handled online. There is more and more online medicine, and that brings me to the right side of the picture. You see a virtualization of care. So that means we are going away from a real world care where you go and see your doctor and you talk to the doctor and so on, to a more virtualized approach where your care will be delivered over the internet, over apps, within network slices and so forth. And these two trends, I think, they are the main drivers for what we see in the moment for an interest in the 5G approach. And I firmly believe that 5G has a big place in healthcare, because I think the question whether processes can be handled in the hospital with other technology is the wrong question. Because why do you want to buy 4G or 3G or anything narrowband IoT when you can do all of that together in a 5G setting? So nobody would do that. No CEO of a hospital would buy half-baked technology where he knows where I can do certain things with this technology, but I cannot do all of it. This is not future-proof. So if you have an hospital and you want to equip it with future-proof technology, these days you would only want to go for 5G. Why do you want to buy a technology that is outdated or can do only half the things you want to do? So other relevant aspects of 5G in healthcare is the technological progress in medical devices. So if you want, this is another big driver. So industries are starting to produce more and more medical devices that can be connected. If you want to manage a hospital effectively and efficiently these days, you need to have devices that have some kind of connectivity. You want to connect all of your devices in the hospital, and you want to have that to control these devices. And the challenge is not only controlling the devices as in where they are, for example, but the challenge is you need a kind of multi-layered model, because on the one hand, you want to monitor patients, and in another layer, you want to monitor the function of your medical device. So for example, if you have an infusion pump, you want to know on the one hand, what kind of medication is flowing, who is getting that medication, how much medication is transported, is it error-free, and so forth. On the other hand, you want to monitor your pump. You want to know, is the battery full? Is this thing fully operable? Is it well connected? And all of these. When is the next time when it needs to be checked in accordance with the medical legislation, medical product legislation, all of these kind of things. So you see already you need a multi-layered model, because you need one layer where you have the patient information, you need one layer where you have the machine information. For the patient information, you need different security than for the machine information. And you do not want to connect one pump. I mean, in a hospital like mine in Leipzig, we have around 1,000 beds. We have thousands and thousands and thousands of different devices that all need to be connected at the same time and need to be overseen centrally, because the last thing you want to do is you do not want to have people with clipboards running around and checking your pump and see whether it works or whether it needs to be inspected or if everything is okay. You get all the human error. It is not safe simply, and I don't think it is really up to the technology level that we have at the moment. Smart pharmaceuticals is another important point. A couple of years ago, 3M in the States have already developed an interactive asthma inhaler. So you basically could bring this asthma inhaler online, and then you would basically see your own performance when you inhale actually the medication, the inhaler performance, how much medication is left in the inhaler, and also you could collect certain data. You could try to apply algorithms that are predictive, that can actually say, wow, you're safe, or wow, there is a risk that you might suffer an asthma attack, and these kind of things. This kind of smart pharmaceuticals that you will use for asthma, diabetes, cardiology, and also for cancer medicine, oncology, you will not be able to run that on a 4G basis. I think this is not feasible. On the other hand, we talked already about the trends, so we have a CBD paradox development in healthcare. You see more and bigger centers because of mergers of hospitals, but the care will not be delivered inside these hospitals. It is all pushed more and more to the outside of the system. And we talked already about virtualization of care. This is extremely important because we do not have the nurses that we need. In no country in Europe, to my knowledge, we have the number of nurses available that we need to take care of all the people. Take also into consideration the demographic development. Also, we have more and more old people that need to be looked after. This will not work. So we will have to switch towards virtualization. There is no other way. And the thing that is really the challenge for 5G is we will need campus networks in these bigger and bigger hospitals or medical campuses, because the communication will have to be effective and in real time. Okay, the next slide, Steph. Yeah. So this is something which I want to announce today. I don't want to hang that too high because it's still early days, you know. So basically, we are a bunch of people that have an interest in 5G, in medical devices, and in medicine. And we were sitting here together at the University of Leipzig. So I'm also working with the University of Leipzig. I'm involved in some technical research on 5G, also student teaching and all the things that you do when you are working in a big hospital. So we came up with the idea of the 5G Health Association, well knowing, you know, that this is early days and that we are just a couple of people that kickstart this. But of course, we hope that events like this will help us to get more people interested. I just posted here the webpage of this 5G Health Association, which just has been formed. So we are not listed yet in any way. We just formed that a couple of weeks ago and started to work. And you can learn details about this initiative, I would call it, on the webpage, and I put you the URL on screen. So if you copy it and paste it into your browser, you can go to the webpage and you can see who's doing what and what is running there at the moment. Steph, if you could switch over to the next slide, please. Yeah, this is just basically a screenshot from the webpage. Don't take that too serious yet. So basically, we are just still in search of a logo. I was saying, well, let's take the Star of Life. But to our surprise, we had to find that somehow the Star of Life is protected in Germany by some kind of patent legislation. I'm still not convinced of that, so we have to look into details there. But as you see, I mean, we're working on that logo. This is still basically kind of work in progress logo. And if you go to the webpage, you can see that. And Steph, if you go to the next slide, please. Just give you an overview about who is in, so who's participating at the moment. So we have Frank Edelmann. He is at Charité in Berlin, so a relatively big university hospital. We have Gerhard Hendricks. He is running the Department of Ophthalmology right next to our hospital in Leipzig. So the Leipzig Heart Center is one of the biggest heart centers in the world. So this is quite interesting. And of course, they have the technological applications that we are interested in. And you see other people from other universities or hospitals or walks of science that have joined us so far. And again, you know, you are cordially invited to participate if you find that interesting. Steffi, if you go to the next slide, please. This is Thomas Neumuth. Thomas, he is professor at Leipzig University, and he is the vice chair of the Innovation Center Computer Assisted Surgery. And he is basically the speaker of our group. And so if you are interested in cooperating, or if you have questions, or if you would contribute, please feel free to get in touch. You see his email there, and my email is on the website as well. So please feel free to email me. I think it is incredibly important that we are making progress with this health association. I know from experience that it is not easy, but it is something that is absolutely needed, because I think this technology is badly needed. And Steph, if you could go to the next slide. We have put together a white paper, which is now in the final drafts. Basically, we are making final corrections, and we hope to publish the white paper in July or August. And this white paper is meant to pick up where basically the white papers that we discussed in the beginning of the talk, where they basically stopped off. So now, with 4 or 5 years later, the knowledge of these 4 or 5 years, we can answer a couple of questions. So what we're going to discuss in the white paper are things like, why do we need 5G for future healthcare? What makes 5G different from current technologies? And we will also show cases, because some of our members of the group, they're running use cases and projects of 5G in the health domain. There are first results which we are going to publish. So 5G to manage the hospital. This is, for example, technological management, like we discussed earlier on with the devices and so forth. And then the department support that goes in the direction of managing patients and basically arranging for patients to move with their devices in the home environment. So again, this touches down on virtualization of care. 5G for post-discharge services is very important, because think of Corona, think of pandemics. That is very important to keep people out of the hospital. And so if they had to go to hospital and had to go home, then we want to do their aftercare, if possible, on a virtual basis. There's an interesting project running in Leipzig now, 5G for emergency responders. So they will equip an ambulance and an emergency physician car with 5G technology, and we'll use a drone to communicate with them for motor vehicle accidents and so forth. We will talk in general about requirements, but also about the key performance indicators for medical applications. I think my time is done so far, and I could touch down only on a couple of aspects here, but I just wanted to give you an update on this 5G Health Association, because this is really important to me, and I think it's really important to healthcare. And with this, thank you very much for your attention.
We thank you, Christoph, for the excellent overview presentation, and also really good to see that you took this move and established this 5G Healthcare Association. So that's really sounds very interesting and a very good move. And personally, at least I will check this immediately. So I think that's good to hear. And I think also what we have heard from you is just in line with what Graham has already presented before, is that it's not just technical challenges, right? But you mentioned then also these health safety concerns, these conspiracy theories and so on, which need to be addressed somehow. And at the end, this might be even more serious challenges than just having the technology ready. But also, I think also here is then necessary to have this close collaboration with the whole ecosystem, but also then including policymakers, governments, and so on, of course. So we received quite some questions, but I think in the interest of time, we wait until the discussion slot at the end and just move on with the next presentation first. And Christoph, of course, you still will be with us, also then in the Q&A session. But let's continue with the next and last presentation of today. And here it's my pleasure to announce Rahim Tafazoli. He's a professor and director of the 5G Innovation Center of the University of Surrey in the UK. Probably well known, so a highly distinguished expert, of course, in the area of 5G and also in all kinds of topics related to the Internet of Things. So he has been working in the field of digital communications and so on for more than 25 years, a long track record with many publications and talks and so on. So it's really a big pleasure to have you here, Rahim, and we're looking forward to your talk now.
Thank you and good day to everybody. Can you see my screen?
Yes, we can.
Oh, excellent. So I would like to talk about a universal healthcare system, mainly from the technology perspective. I'm not going to talk about the market statistics. I think an example of that one was provided by Graham from NHS point of view. And there's many market statistics and importance of the e-health or m-health in reducing the cost to the health services and enhancing the productivity. So I'm not going to go through that, but my presentation mainly focuses from the technology perspective and to some extent try to explain why, despite more than 15 years, like Graham said, he's been in e-health for 15 years, why it hasn't happened so far, e-health, in a wide scale adoption. So let's start with the situation today. We are facing many challenges, from aging population to unhealthy lifestyles, dementia conditions, community care, and growing mental health, which is very important now. People started realizing how important the mental health is. And recently we have realized we don't have any system or mechanism technically for controlling and monitoring infectious diseases, plus many other aspects. The situation today also is severe staff shortage, medical and non-medical people. I have to say that this presentation, even though that I'm not a medical person, but I work on a national and European projects working with the medical people, which brings the problems on the table. So most of this presentation is based on that experience. Unavailability of the expensive operating rooms. I heard that for every day that we cannot book an operating room, I heard this figure in Germany, I think it was about 3 million euro is lost because the surgeon expert is not available, or the room is not available, or the surgeon and the room that are in the same location. Time critical response and hospital capacity shortage that we are facing. So from the telecare point of view, mobile is a very universal system that is everybody, more or less, is using mobile. So it's a good platform to start for e-health or m-health using mobile system. What m-health or mobile health brings to telecare is empowers the healthcare professional and patient-centered care provision, as well as the patient empowerment. What we need to do, instead of coming with bits and pieces of technology, we need to come up with an integrated solution, integrated telecare solution that provides care from home, when you are outside home, we are in a community, you are at work, is the same system provides this telecare for you. At the moment, we don't have such a system, integrated system. We have bits and pieces of different technology which are totally incompatible and do not talk to each other. So from the remote surgery and diagnostics, it doesn't have to be a robot at the end to do operation, but you can provide a remote operation using the expert, depends where the location of that expert is, and provide high quality virtual reality or augmented reality using 4K and 8K video. And that can be met by 5G, where other systems cannot do it. In terms of capacity, the large number of machines and people connected, no other technology is available. It can do it except 5G. And when we talk about the real-time operation and guaranteeing the latency, and that is inherent property and aspects of 5G. And when we talk about remote operation, reliability of the link, reliability of the connection, and resilience of connection, which is an important aspect of the 5G, it can be provided through a dedicated network or a slice or a private network. And these are the features that 5G can provide. Security mechanism in 5G, as far as the network security is concerned or the data security is concerned, is a more enhanced version than what 4G and other systems, wireless system can provide. When we talk to data anonymization, that is an important area, especially when we talk about the patient's data. When we look at more advanced, I think it was Christopher mentioned about real and cyber world interactions. And when we talk about 360-degree virtual reality with a high quality bandwidth, by high quality video, for a typical and average size person, 6'4" by 20 inches, we are talking about something like, with today's technology, about 4.6 terabits per second, which is beyond what 5G can do. And probably we need a new system beyond 5G. On the viral diseases pandemic, we realize the importance of the contact tracing and scalability, and also the privacy of the system. And not only to provide spatial and temporal dynamics of the virus spread, but also to do real-time update to individual for the healthcare, as well as for the connection to the health authorities. Proximity and alerting in distance observing became an important issue, which we don't have a system integrated in our wireless, cellular, or private networks. Social interactions, you know, talk about 1 meter plus or 2 meter, and subject of this exposure to be more than 15 minutes is a high probability of passing the infection diseases. So for this, what we have developed is an app using the inertial sensors in any smartphone, and it can find location inside the building or outside the building better than 1 meter accuracy and with a high scalability issues. And our solution is reduces the energy consumption based on any other technology by 30%. And it has high accuracy and reliability of more than 95% compared to existing solutions, which is less than 80% accuracy. It can provide real-time spread and monitoring, predictive spread patterns detection, real-time notification and reporting, and provide suggested safe routes based on user demands and the user's density in different locations. And the accuracy I've already mentioned is better than 1 meter, and it is not only 2-dimension location, indoor and outdoor, but also it is 3-dimension. So you can find whether the person is on a second floor or the 3rd floor, or which floor it is. And with some AI and some data analytics, you can figure out, monitor in real time the spread of the diseases. So what we need to have in place for the e-health or m-health is to become a reality. I think some of this has already been mentioned by previous speakers. We need to evidence of the system is effective and reliable. We need a right regulation in place. We need collaboration between medical and telecom and SMEs and large companies and application developers. And also we need awareness, education, and training of the workforce for medical people, as well as for the engineers. All these are important ingredients which will help for e-health and m-health to flourish. So what, from the technology perspective, what do we need to be in place? We need an integrated solution. We don't need a piecemeal for different health issues, different systems. We need an integrated system that provides a common standard, and it has to be a global standard. It shouldn't be proprietary standard or regional standard. And that standard should have a common specification on the wireless technology, on the devices, interfaces, as well as the data models. What should be the data model to do the data analytics on top of that? We need a medical predictive language engine for medical people to save them time when they want to dictate, do the dictation of, rather than just writing everything on a piece of paper or on the files. The technology that we don't have is at the moment, and it should be researched and innovate on, is user context detection and monitoring status of the target patient, like any status, whether it's walking, is standing, or lying, or sleeping, whatever is the user context and user state is. Equally important is accurate and scalable indoor and outdoor geolocation information. We need accurate sensing technologies for wearables and non-wearable to collect data, and variety of different data based on agreed data models. And that sensing could be even taste or smell or state of mind, which is the person for mental health issues, which is the person is happy or sad, or what makes the person happy or sad, or any other mental conditions. Security and privacy preserving solutions, especially on the user data. Data analytics with prediction and recommendation and notification and incident classification. We need to have a technology to be able to aggregate data, do the aggregated data analytics, and AI for prediction, especially for cases for virus infection, spread, hotspot, and the rate of spread or shrinking of this virus system. So, in case you ask, there has been lots of rumors about 5G and relating that one to COVID-19 or any other issues. So for this, me together with my colleagues from Glasgow University, Professor Imran and Professor Rob Stewart from Strathclyde University, we embarked on writing a technical but in a very simple language, trying to answer all the myths and rumors about 5G, facts versus fiction. And that has been published. And I suggest you to have a look at this publication because it answers a lot of questions that the rumors are spreading. Thank you very much. And I'm happy to answer any questions if the chair allows that.
Yeah, thank you very much, Rahim. That was really interesting. Thank you very much for the last point that you raised. I think, Andreas, we've agreed that we'll move on to the panel discussion with all three panelists. And then we'll just spend a few minutes at the end with another panel, with another poll to ask you what you'd like us to do webinars on in the future. So I think we can start the panel discussions. We have a few questions in the Q&A, but we could start with a general question of, you know, what do the topics, so what do public safety, healthcare and social care have in common? What are them and what are the main differences? And then I think we could have a question about the future and where we'd like to take it. Okay, so maybe Graham could ask it the first question. Graham, are you happy to take that question?
So the kind of connectivity between the health and social care and the requirements of the emergency services. I think there's things around security. There's also things about reliability and network resilience, I think. So those are the kind of common features that I think you'd start with. I think that there's also latency, isn't there, as well, I think, that would be important. That's my starter.
Thanks very much. Graham, I don't know if Christoph or Rahim would like to add to that. Please take the floor. Thank you.
Well, if I would like to reiterate that what the message I was trying to convey in my presentation, that we have been talking about mHealth and eHealth for many years. And if we don't have a common, agreed global standard from the economy of scale, we will be talking about this for the next 15, 20 years again, and nothing will happen. So I think that in addition to the regulation, etc., that needs to be in place, we need to have an integrated and a standardized solution which would make the equipments and deployment sustainability with a substantial ecosystem and value chain behind it for this to become a reality for eHealth and telecare and mHealth.
Yeah, I think that's an excellent point, actually, Rahim. In fact, in our first webinar that we did in May with the 3GPP, we did highlight the need for economies of scale in global standardization. And one thing that we did start doing last July when we did our first a workshop physically with 3GPP, we did a mapping of common requirements across industry verticals. And I think this is something that we definitely need to pick up on after the summer. And I think it's really important that we do start understanding where the commonalities lie and how, you know, I'm just giving the case of 3GPP because it's the one that we know best, but how they're building a set of functionalities as a toolkit that industry verticals can cherry pick to create their own services. And that they are applicable across a wide range of industries. Clearly, there's a lot of work to be done on healthcare. I agree. I was also, I've had many discussions also with Christoph, and I'm very pleased to see this association coming together and very happy to support it moving forward. So I don't know if Christoph, you would like to add anything to this point that we're just discussing?
Yeah, I basically would agree with Rahim and yourself and what was said before from Mark also, from Graham also. I think one thing maybe allow me to add to that. Several years ago, I think it was 2013 to 2015 or something like that, we did a relatively large European project. It was then called FI STAR, so a Future Internet Social Technological Alignment Research. And when we presented that project, I can remember that, we were sitting in these panels in Brussels and so on, and they would ask us, what do you mean by social technological alignment? What is that? And so on. So by the end of the day, we have seen that, especially when you look at 5G, PPP and so on, there was lots of money allocated to technological innovation, to new developments and so on. And there was only very, very, very little money allocated to actually prepare the ground for this technology. And I think this comes a little bit now to bite us in the bum, because exactly what Rahim said, we have the technology, but mHealth, eHealth, it doesn't lift off, it doesn't fly. And we've been trying that for ages. So I believe strongly what we need consent, we need information. We need, in the end of the day, some kind of European project, some kind of European funding, helping us to provide or to prepare the public for this 5G, especially in healthcare, to raise the adoption of that, to really make people understand what is it good for, and to clear up all of these myths Rahim was talking about, because this is really an obstacle. Because we see in the moment that politicians, they shy away from rollouts and so on, because they're confronted in city hall talkings, when people storm in and present some papers of basically suggesting that 5G would create waves that would kill us or make us sick and all of these kind of things. So I think it is extremely important that we need to focus on information strategies in order to reach societal consent on the introduction of these technologies. And I'm not talking only about 5G, I'm talking about 6G and 7G and what there is to come. The people have not accepted yet, and we will have to work on this.
Yeah, no, that's another really good point. In fact, this infodemic we're living through is quite, not only dramatic, but it's also having a very negative impact on people's understanding of 5G. So I thank Rahim and his colleagues for helping to set the record straight on that one. But it's also giving people the wrong idea of what security is, because we're not told what security issues actually are about. So there's a lot of myth to clear, I think, and I definitely agree that this is a conversation that we definitely have to take forward. I don't know if anyone, or Graham or Rahim, want to add on top of your comment. Please feel free to do so.
Because I don't know whether I talk too much or give or not, but I would say
it's
that
never enough, right?
If I say the most important on the security one is, of course, one of the features of the 5G is slicing. Slicing, you can set up a complete virtual network dedicated to health with by design, providing security, resilience, and more importantly, when we talk about security, we talk about the patient's data privacy and anonymization of that data. So that aspect is yet to be developed. And other aspects, I want to share some of the experience that we had with one national project. We had a case with the dementia conditions, and there were 9 SMEs were involved in that project. And each of SMEs had a variety of different devices for different diagnoses, whether from blood pressure to many different applications. I can't remember now. When we came to integrate all of this, we realized none of them devices talk to each other. So we first started for the first 6 months, specify a common interfaces that everybody has to change the devices to that common interfaces, so everything can be integrated. For the rooms that we actually sensorized, was a bed and kitchen and I don't know, the sofa and everything else. So to be able to talk to each other, so common standards and common agreed security preserving and privacy preserving technology, together with geolocation, I mentioned geolocation and the user context, is extremely important for these things to fly.
Thanks a lot, Rahim. Maybe I take it from here. So I think standardization, of course, is always crucial and key. And in many cases, as you also indicated, it's also then beyond just the standardization maybe of the 5G system, but also all the other aspects around this. And that's why I really like, again, the new 5G Health Association, which certainly might play a role then in identifying gaps and at least driving and pushing corresponding activities to make sure that all these white spots that may still be there are probably addressed as well. Since time is flying, so there are 2 questions in the Q&A section focusing a little bit on the use cases. Maybe we should briefly bring them up. So one is about, I mean, we have heard that remote surgery maybe is something that will not happen in the foreseeable future, maybe robot surgery as well. It's also the question for a business case. But first question is, what about removing the cables in the operating rooms, for example, and coming up with a completely wireless operating room? And the other one a little bit related to that. So how do you see 5G for in-hospital communication? So currently, of course, there are different technologies in use like DACT or voice over Wi-Fi and so on. And of course, in future, this may also be done using 5G, maybe a 5G campus network, question mark. So any thoughts on these aspects?
Andreas, if it's okay, then I might kick off with something here. Is that okay? Yeah. I think, I had tons of discussions about exactly this topic, I mean, do we need 5G in the hospital? Why do you need that? You have all of these gigabit pipes and all of that. Why do you need 5G in the hospital? In order to understand that, you need to know a little bit about health economics and how hospitals work, So back in the 30s and in the 20s of the 20th century, hospitals were purpose-built, and nobody would expect that these hospitals would ever change inside, So there was a theater tract with operating theaters, and it would remain operating theaters until the end of the lifetime of the building. This has completely changed. So we are living in a very high-paced, fast-lived time. So that means if you are running a hospital these days and you have, for example, theaters for, let's say, ear, neck and throat surgery or gynae or God knows what, you find after a certain while that this does not pay off for you, or your demographics change and you don't need that anymore, then it is not unusual that after maybe 5 years, the CEO of the hospital says, well, this does not pay off for us. We cannot afford that anymore. Let's change the specialty. Let's appoint a neurosurgeon and let's open a neurosurgery department. So everything is moving in the hospital then. So everything is, the theaters are packed into a different tract in that area where there was the theaters. There's all of a sudden moving a different clinic in and so on. Now, the problem with that is it is extremely expensive if you have a copper or glass fiber-based communication system, because you need to rip out everything, you need to put new cables in, and this is not a matter of 100,000 euros or dollars or pounds. Yeah, this is a matter of millions sometimes. If the bigger the change, the more complex the adoption, the adjustments. Now, this is exactly the point where technologies like 5G come in, because the wiring, the hardwiring of the hospital will now not be important anymore, and I can save already when I build the hospital billions of dollars, euros, or pounds just by having that 5G core, and I can basically switch around my layout of the hospital whenever it is economically needed. And I think this is so important for these days health economists, for the people that run hospitals, that is basically a key point for having 5G in the hospital.
Yeah, thanks a lot, Christoph. Very good remarks. Anybody else wants to add anything to that?
I'm sorry, I know very little about wireless operations in hospitals and general IT in hospitals, so I think it would be wrong for me to comment.
Yeah, I think that's perfectly.
Is it okay, Andreas, maybe to add one more thing from the point of view of somebody who has to work with that every day? So, for example, we have, like many hospitals, wireless systems installed, and today our ward rounds and so on, they're all based on computer systems where we look at patient files and so forth. And I can tell you that wireless technologies, as we know it, is definitely not the solution. Yeah, so we need a much quicker response. We need lower latencies, especially when it comes to transmitting X-rays, high-resolution X-rays, and so on. This is all far too slow. And everybody who says, wireless is okay, is invited to join me on a ward round, and they will see where the problem lies. So one more reason for me to be a big 5G fan, and to hopefully see a faster service in the future.
All right, so we just noticed that we are already approaching the top of the hour, and of course we want to be respectful of everybody's time. I think we just scratched the surface, of course, now with the discussion and also the short presentations, but anyway, it was a very good kickoff of also deep diving a little bit into the healthcare domain, social care, and public safety, of course. But before we conclude the meeting, we just have prepared another poll, and for that I would hand over to John again.
Yeah,
thanks very much. Thanks. Okay, I have launched a polling now. We have had a very successful set of seminars, of webinars. We've already done 3, and we plan to do more, but we would like to hear from you now. Please vote for one of these topics for an area of either a vertical area or a horizontal technological area, and we will do our best to take care of this and present these in future seminars. Please, by all means, let your voice be heard.
But we are definitely taking forward, though, the healthcare and the social care aspects as well, and obviously through David and the PSCE, they will be taking forward a lot of discussions on public safety. So, stay tuned for that, because I think, as Andreas said, we've only just started to scratch the surface on this, and I think that informing people is first and foremost one of the most important steps that we need to take. So, but please, this is why we're doing the poll, because we want you to have a voice in the work that we do, obviously. You all play an essential role, even if you're not actually a panelist. We're all important on the road to 5G. How we're doing, John? On the
so you should be seeing this the results.
Yeah,
now.
I can now. Yes. Mm-hmm.
Okay, excellent. So 53% are interested in hearing about the 5G technology enablers from network slicing, which was talked about quite a bit today through edge computing and others. And you can see a whole array of other possible topics including a very great interest that continues in healthcare.
Yeah, that's very good to see, in fact, because as I said, we really have a lot to talk about and a lot to do, and to set some targets and look at where the funding might be allocated in the future, a very near future, hopefully. I think that is fundamental. And the standards, of course, as well. Well, thank you, everybody. Thank you, Andreas and David, for your support, and you as well, of course, John. A big thank you to our panelists, Christoph, Graham, and Raheem. You've given us some really great insights today, and a lot to think about. I think, there is an awful lot to think about. on these really important topics. And if there's a lesson from COVID-19, it is the growing awareness of just how important the healthcare system is, and the public safety as well, and our networks also as a critical infrastructure. So I would like to conclude this webinar today. Please stay tuned. There's lots more. We'll be sharing over the coming weeks the report, the presentations, the recording, and some of our reports. And we'll also be sharing after the summer the upcoming webinars, taking on board this poll just now. So thanks everybody. We haven't had time to answer all of your questions, but we will collect them and find a way of sharing the answers with you over time. I wish everybody a very safe and happy summertime wherever you are. I know not many people can travel, but do please stay safe and stay smart in your thinking about 5G and healthcare and social care and public safety, of course. So thanks again, everybody. Thank you to our great panelists. And I'm so pleased that we've had a fantastic turnout over these last 3 webinars. I think it's a good basis for moving forward. We have a lot of work to do. So thank you, everybody. Stay safe.